Have you ever stopped to think about why a medicine that's totally fine for a 40-year-old might actually be pretty risky for an 80-year-old? It's a really critical question because the way our bodies handle drugs changes, well, a lot as we get older. So let's dive into why that is. First, let's talk numbers. 88.5 million. That's a huge number, right? Well, that's the projected number of Americans who will be over the age of 65 by the year 2050. To put that in perspective, that is more than double the number from just 2010. And this chart, this population pyramid, it shows you exactly what's happening. You can see how the top of the pyramid is getting wider and wider. That represents millions of people moving into that 65-plus age group. This massive shift is exactly why it's more urgent than ever to understand how older bodies react to medication. Which brings us right to the heart of it all. What is actually going on inside our bodies over the years that can turn a standard, helpful dose of medicine into a real problem? That's the core question we're going to tackle. And here's our game plan. We'll start with the scale of this growing concern. Then, we'll get into the science of how the body changes. After that, we'll look at a real-world story, a domino effect of what can happen. And we'll wrap up with the smart strategies doctors are using for safer prescribing. Okay, let's get into the science of it. You see, a drug's journey through your body is just not the same at age 75 as it is at 25. And to really get it, we've got to follow that journey, step by step. So in the world of pharmacology, any drug you take goes through 4 basic stages. First, absorption, getting it into your bloodstream. Then, distribution, where it travels around your body. Third is metabolism, where your body breaks it down. And finally, excretion, which is how your body gets rid of it. Now here's what's interesting. For most drugs you take by mouth, that first step, absorption, doesn't really change all that much as you get older. The really big differences, the ones we need to worry about, they happen in those next 3 stages once the medication is already circulating in your body. So let's talk about stage 2, distribution. Think of this like a package delivery route. It's where the drug is going to travel inside your body. But as we age, the roads, the whole landscape, it changes a lot. See, a younger person's body has more water and less fat, but in an older adult, the total amount of body water can drop by as much as 20%, while body fat goes way up. So what does that do? Well, water-soluble drugs become way more concentrated because there's less water to dilute them. And fat-soluble drugs, they can get trapped in that extra fat tissue, meaning they stick around in the body for much, much longer. Okay, on to the final 2 stages, metabolism and excretion. This is basically your body's cleanup crew. The liver does most of the work breaking drugs down, and the kidneys are the main exit route. And guess what? Both of these crucial organs change as we age. Now, while liver function does change, there is one change that is so consistent, so predictable, that doctors can almost bank on it. It is the single biggest factor in how an older body handles medication. Any ideas what it is? Yep, it's the kidneys. The ability of the kidneys to filter out and get rid of drugs is the most reliable, predictable change that happens with age. As that function slows down, drugs that are normally cleared out by the kidneys can build up and up, sometimes to toxic levels. And this really shows you how critical this is in the real world. Doctors literally use mathematical formulas to estimate how well someone's kidneys are working, and age is always a key part of that equation. It's solid proof that when it comes to medicine, age is so much more than just a number. It's a vital piece of data for figuring out a safe dose. So, we've seen how the body's internal machinery changes. But what happens when you introduce another super common factor for older adults? Taking a bunch of different medications all at once? Well, this is where things can get incredibly complicated, incredibly fast. Let's make this real. Let's look at an actual case study. We're talking about an 82-year-old man with a pretty complex medical history. He's had a kidney transplant, and he's also managing several chronic issues like diabetes, heart failure, and early Alzheimer's. As you can guess, that means a lot of prescriptions. In fact, this man was on a daily regimen of 13 different medications and supplements. And for the most part, things were stable. Until his doctor added just one new drug, an antibiotic for a case of bronchitis. And that one little pill, it set off a dangerous cascade of problems. This chart shows you the domino effect in action. That new antibiotic, clarithromycin, started messing with two of his most vital medications. It blocked his body from breaking down his blood thinner, warfarin, which skyrocketed his risk of a serious bleed. At the very same time, it boosted the levels of his anti-rejection drug, cyclosporin, putting his precious transplanted kidney in danger. It was a perfect storm of drug interactions. And it's not even just about how drugs interact with each other. The body's actual sensitivity to the drugs themselves changes too. An older brain, for instance, can be way more sensitive to sedatives, making someone feel dizzy or confused. Meanwhile, the heart might become less responsive to other drugs, like beta blockers, meaning a standard dose just doesn't work as well.
Now, all of this might sound a little scary, I know, but the really good news is that because we're so much more aware of these risks, it's led to some much smarter, much safer ways of prescribing medications for older adults. And it all comes down to this one simple mantra. You'll hear it all the time in geriatric medicine: start low and go slow. Because of all these changes and risks we've talked about, the best practice is always to begin with the lowest possible dose and then increase it very, very slowly, all while keeping a close eye on how the person is responding. Doctors also have some amazing tools in their toolbox to help with this. There's something called the Beers List, which is basically a guide that flags medications that could be risky for older patients. And then there are tools like the Drug Burden Index, which helps a doctor calculate the total sedative effect of all the medications a person is taking put together. So if there's one thing to take away from all this, it's that when it comes to meds and aging, one size fits all is just not an option. And that really leaves us with a final, empowering thought. Whether it's for you or for someone you love, knowing about these changes helps you be a better advocate for your health. So the next time a new medication comes up, what do you think is the single most important question you should ask?